Picking the right treatment options for someone's heavy or disruptive bleeding can be daunting. Too often I see patients potentially not selecting an option because they're just a little bit uncertain which one's the right one for them. In this video today, we're going to be talking about two of the most common options and best options for managing heavy bleeding, disruptive bleeding going forward. My name is Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon. Let's fix heavy disruptive bleeding in this video. Unfortunately, there's not always a best fix for everyone when it comes to a given problem. However, a lot of times with my patients, we're in discussions of treating their bleeding issue and we're down to these two options, the IUD or levonorgestrel IUD or the endometrial ablation. So let's talk all about those options right now. What's nice about the IUD and the endometrial ablation is they're uterus saving options. I think too often people come to me not realizing these are good options for the treatment of heavy bleeding, and they're already thinking they want a hysterectomy, but while some that may be the right answer, now generally these options can help a lot of people too. Brief overview of each option. Specifically, levonorgestrel IUD has 52 milligrams of levonorgestrel within the IUD. It is approved for 5 years of use. Recently, for contraception, it's bumped up to 8 years of use, which is good. But some patients after that 5 years might have their bleeding start to come back. The IUD is often thought of in the form of contraceptive. However, it helps with a lot of different other issues, whether it's bleeding, whether it's dysmenorrhea or pain, endometriosis, adenomyosis. It helps with all those, even prevention of certain cancers like endometrial cancer. And so IUD is a lot better than I think people give it credit for. The IUD can be inserted now in the office or potentially under anesthesia. And what I see with IUDs and patients that come into my clinic or what I see for comments online is that it just has a bad rap out there because there are a lot of people that potentially had a bad experience with the IUD, but there are usually so many other people that maybe had a good experience. And so when you hear a person's personal experience, it's good to take that into account, but you shouldn't take that as solid, undisputed, as far as finding the best option for you. So before we start talking about endometrial ablation, I just want to do a quick ask of you. Now, I promise that I'll never give you biased information. I'm probably never going to give you really polarizing takes that are going to cause millions of views, but hoping to just give you decent information. So if you don't mind, like, subscribe. It really does help me to have the motivation to create more content as I'm doing a full-time OBGYN, GYN surgeon type job. And so if you don't mind, please do that because it looks like only about 5% of our viewers do subscribe. So thank you everyone, back to the video. Endometrial ablation. We're gonna abbreviate that because I don't have the room. Is a really good option to help people with bleeding. Now, this generally has a better reputation when it comes to online and patients coming into my office, potentially knowing about endometrial ablation, maybe wanting it. Now, endometrial ablation isn't a contraceptive, and so someone may need additional contraception if they are wanting to do endometrial ablation. That's not always something that people are aware of. This is an outpatient procedure. Some places do this in office with a lot of local anesthesia and maybe some forms of sedation, but generally a lot of these are done in the operating room where a patient is fully asleep and comfortable during the procedure. There are a few different ways which you can do an endometrial ablation. Basically what it is the burning or destruction of the endometrial lining so that it doesn't grow back. And so this can be done often with heat, sometimes with cryo or cold therapy, but often with heat gives the best results and makes it so that that lining doesn't grow back and the inside of the lining gets scarred. And we'll talk about that when it comes to potential issues and complications going forward, but that's the intent of the procedure. Let's get into the head-to-head of IUD versus endometrial ablation. I'm going to rank some of the common scenarios that I see where someone's choosing between an IUD and an endometrial ablation. I'm going to rank it out of 5. And so 5 stars, best score, 1 star, or 0 stars, worst score. Let's go to the first scenario. Let's talk about how quickly it fixes a problem. So the onset. How quickly is an IUD going to fix the bleeding issue versus an endometrial ablation? So endometrial ablation kind of gets 5 stars. It should work right away. It's done, the ablation happens generally within that first cycle or two, depending on where someone is when they get the ablation. Hopefully that has immediate effect. They might have a little bit of discharge for potentially up to a couple weeks afterwards, but It is overall a very quick resolution of the bleeding if it works as it's hopefully going to. IUD, I'm going to give it a 2. IUDs do generally take about 3 to 6 months to fully have their most beneficial reduction of the bleeding. It takes about 3 months. At about month 3, you're hopefully going to get about 80% reduction. At about a month 6, hopefully about a 90% reduction in that given person's menstrual bleeding. So amenorrhea. So what are the chances that this actually takes away your bleeding altogether? The surprising thing I think I see is patients with endometrial ablation think they'll have no more bleeding ever again. Unfortunately, that's not the case. It's actually probably closer to 30 to 40%. We'll give it the benefit of the doubt, say 40%, just based off my own gut feel. That's going to give, I think, 3 stars there for endometrial ablation. IUD, it's kind of close, actually. IUDs, give or take 20 to 30% of women that have an IUD, it takes away their bleeding completely, which is usually nice. People like that. And so it's a little sad I think, for people. They think the endometrial ablation is going to do that. For the IUD, I think it's a little surprising. People don't realize how much it takes away. So I'm actually going to beat that, give the IUD a 4. So another option. Let's talk about the complications. I'm once again going to say the IUD isn't for everyone. When it comes to complications, they can range from the fact that it is a hormonal medication. There is hormones, however, highly concentrated in the uterus, not as much throughout the body. If someone were to take an oral hormone medication, the IUD only creates about 20% of that hormone throughout the body. So it's much less than the low dose hormone options. But there is a risk that someone could have hormone side effects. Those would include things like headaches, mood changes, things like that. It's hard to believe a significant component of weight gain, but we still just say that. And there's an extremely rare chance that if someone were to develop a potential estrogen or progesterone positive cancer, particularly of the breast, this could potentially feed it. We wouldn't use the progesterone IUD in those situations. Overall, though, it is a very safe option and it can be removed. Okay, if someone's having those issues, you take the IUD out, it should resolve the issue. There is an extremely rare complication of inserting the IUD. It can poke through the uterine muscle, potentially completely, if there's a difficult IUD insertion. This is much less than 1%. And often you can potentially ask to have your IUD inserted with ultrasound guidance for, again, reassuring that this isn't the issue. But if an IUD is inserted in the right area, it really should not all of a sudden just push through the uterus muscle. It's usually an issue with the insertion, if that were to happen. There's about 5% risk that when someone gets their IUD, that it might fall kind of out of place, fall lower in the uterus, potentially fall completely out. And that is usually in the scenario if someone gets it immediately postpartum, or if that patient potentially has a lot of heavy bleeding, it might come out in a big blood clot before the IUD really has a chance to work. Usually that's kind of within the first month or two of someone first getting their IUD. Again, they're pretty rare. And so overall, the complication rate for an IUD is much less than people think, and it's reversible. And so I'm going to give my gut feel of a 2 there. Complications with endometrial ablation. Again, overall, it's a very safe procedure. It usually goes very well with minimal to no complications. It is a procedure where we're inserting something into the uterus, and so the same with the IUD, there's always a potential chance of poking into the muscle. Extremely rare, again, around 1%. And the devices that we have to do the ablation help protect against that. But however, one of the issues with endometrial ablation that I don't hear a lot of patients talking about is that the lining can start to grow back. Often I say that an endometrial ablation works really well for 5 years, of 5 more menstrual years after you get the endometrial ablation. But then the lining starts to grow back, reproliferate, and we talked about how that scarring happens in the uterus. Well, if it scars all the openings shut and you have bleeding in the middle, it can't get out, and it just stretches the uterus, often causing some pretty debilitating cramping. It happens about 10 to 15% of the time. It's often one of the bigger issues with an endometrial ablation. And so those patients often will usually elect for a hysterectomy if that does happen to them. And so I'm going to rate endometrial ablation complications potential 3. Let's go over some potential treatment scenarios. So if somebody has something called adenomyosis, which I don't think is actually talked about enough, it's when the uterine lining and the endometrium starts to grow into the muscle, creating some inflammation, some increased bleeding, pain. So adenomyosis is usually heavier bleeding cycles, more painful bleeding cycles, and can be a pretty big issue that I don't think is talked about enough. Its cousin, endometriosis, is talked about way more, but adenomyosis is a big issue that a lot of people have. IUD, it's a great option for adenomyosis. I'm just going to say it. It's a great option. If someone is okay with an IUD, it's a great option for adenomyosis. Endometrial ablation, 2 stars. It's just not the best option because if that adenomyosis is burrowing into the muscle too deep, the endometrial ablation burns about 4 millimeters depth for the device that I use. And so if that adenomyosis is beyond that, it generally doesn't get treated and may turn out to have persistent cramping after the endometrial ablation, making it so it doesn't work. So we have to be very careful with adenomyosis, and I look very carefully at the ultrasound images or MRI images when somebody is considering endometrial ablation and may have adenomyosis, because endometrial ablation isn't always the right answer for this. I'm not going to put it on here, but endometriosis, IUD can potentially treat that. Endometrial ablation wouldn't. So a younger patient, if a patient is in their 20s, if a patient is in their 30s, or potentially their early 40s, are they a good option for either of these options? What's good about an IUD? It's good for almost all of these age groups that we just talked about. Endometrial ablation is really good for people, give or take 5 years left or 5 menstrual years left of bleeding. And so generally mid-40s, endometrial ablation, that's the perfect thing. And it's non-hormonal. But for the younger patient population, again, if somebody's getting an endometrial ablation in the 30s, the more menstrual years they have ahead, it's just probably not the best option. And so, I don't know. For the younger population, I'm going to give it a 2 again. About complications earlier, I meant more major complications. Let's now talk about side effects or like hormonal side effects. IUD can cause some side effects, whether it's the persistent cramping with it, the insertion of it. Specifically, I'm talking about people who have an increased sensitivity to these progesterone medications. They certainly can get some side effects from it. Often I see potential headaches, potential mood changes with the IUD if someone is going to have a side effect, which I would say is usually pretty rare, but certainly can happen. And so IUD, I'm going to give it a 2. Endometrial ablation, it's a non-hormone option. It just causes that scarring. We talked about that already, the complication. We talked about that endometrial ablation syndrome where the lining starts to grow back, so I'm not going to include that here. But the side effects, if someone's endometrial ablation is going well, I mean, they really like it. Again, someone in their later 40s just needs a few more years till they get to menopause. And so this is good. Now, both of these options really aren't to combat the fibroid. It's mainly to combat the symptoms of the bleeding of the fibroids. And so if somebody has a distorted cavity, both of these options may not be very good, meaning the IUD is just not going to sit correctly, or the endometrial ablation device is just not going to work properly. And so fibroids, generally, my cutoff is they should be less than 3 centimeters, but they both can control the bleeding decently well. I'm going to give them each a 3, but not good for bigger fibroids generally. Let me talk about actually one additional thing. Hyperplasia of the endometrium, where the lining of the uterus is starting to become abnormal, potentially precancerous. One of the potential treatment options for this, besides something like a hysterectomy, let's say if someone has this hyperplasia, they're in their 30s, they still want to keep their uterus, especially for the option of childbearing, an IUD is the perfect treatment for that. 5+ stars for that one. Endometrial ablation, -5. You never want to do an endometrial ablation if someone has precancer, cancer, and so the IUD is beneficial for protective of the uterine lining. And with another thing with endometrial ablation too is once someone has an endometrial ablation, there is always a chance that if that lining grows back, it could further make it difficult to get back in the uterus to sample the lining if you're worried about hyperplasia or something like that. So this was my honest review of different scenarios and how they help each individual patient. Now there's still multiple other factors that can go into these, and so it's not all inclusive, but it gives someone a general idea on how we think as clinicians for these different things. And so ablation, great option for somebody in their mid 40s. It doesn't give you contraception, so you might need some backup contraception if you get an endometrial ablation done. But it's a really good, quick option, non-hormonal option for somebody in their, you can do it anytime, but generally good for somebody in their mid-40s. IUDs can be good anytime. Now, IUDs are difficult with insertion, especially if someone hasn't had deliveries before. And there's different ways. If you want to watch the video that Dr. Valieva and I talked about pain control options for things like IUDs, and then insertion and managing going forward, watch that video. IUDs get a bad rep out there. They're actually pretty good. But let me know what you think. Everyone be positive out there. Hope you enjoyed this video. IUD versus endometrial ablation. I'm going to have some more comparative videos coming up near future. Everyone have a great day.